Okay.
Going
Going
down.
down. Good, good, good. What's up with you? How are you?
Just doing pretty good, doing pretty good. How you doing?
I'm doing well. Got my jersey on today.
There we go. There we go.
Shout
Them
out.
Hornets, they doing it.
They are. I'm very proud of them. They must have got some of that Panther juice and it's running through them. So I'm excited to see them getting some victories this
Yeah,
season.
yeah, they're looking really good. So yeah, I'm proud of them too. Hopefully they can keep it up, make a playoff run.
Maybe. That would be exciting. I mean,
Hmm.
one for one, that would be cool. Both our teams making it. Then I think we got a basketball team. Have you seen The Crown? It's
Oh,
like,
the women's, yeah.
mm-hmm.
I haven't seen a game or anything yet, but I heard that they were coming. So yeah, I'm excited about that too.
Yes, indeed. So let's just jump into it.
Let's
Oh, and
do it.
happy Women's History Month. It is March. We have to figure out some topics to discuss
Oh,
about
no doubt.
this month. But welcome back to another 10 Toes Down episode where culture meets foot health. And tonight we're talking about something that hits pride, fashion, Medicare, and mobility all at once. So let's be honest, nobody is growing up thinking that they want to wear a pair of diabetic shoes. But if I told you that those ugly shoes could literally save your foot, would you listen to us? So,
You better.
Dr. Here, break it down. Why does the diabetic foot program even exist?
Yeah. So it was long recognized by doctors, professionals, and then later by our elected officials that diabetes can ruin your feet, right? So you have all these things, all these complications that can happen from diabetes, and a lot of them happen in your feet. So we're talking about losing feeling in your feet, having ulcers in your feet, and then ultimately those can lead to amputations. And so it was decided that something had to be done. So like in the 80s, legislation started to be talked about. What can we do to help prevent these ulcers, and what can we do to try to save these folks from having to undergo these costly, amputations? And so I believe it was like in 1993 where the legislation passed, where Medicare would then cover some of the cost of diabetic shoes as well as inserts. And so they realized early on that, hey, we have to do something to try to stop all of these amputations and these surgeries and this morbidity that's happening with diabetes in the feet. And so that's why the Diabetic Shoe Program came about.
Wow. So, of course, here's some data. Here's a data drop. 37 million Americans have diabetes. One in three diabetics will develop a foot ulcer during their lifetime. Of course, we already heard Black Americans are twice as likely, more likely to undergo lower limb amputations versus our white counterparts. And 85% of diabetic related amputations are preceded by a preventable foot ulcer. So going back to that, a high number of percentage of these things can be prevented. So you spoke about neuropathy, and I know we talked about it in the past, but give us a refresher. What
Yeah.
happens in the foot when someone has neuropathy?
So initially, when folks have neuropathy, they may not even know that they have it. And so initially, basically what it is that they just kind of start to maybe get a little tingling every now and then. Usually people say, hey, when I go to sleep, my feet feel like there's ants crawling on them. And then when it progresses, then you start to have, more pain, a lot more numbness. And then that's when you start to get into the realm of all these complications. So neuropathy is just basically losing sensation in your feet, then it progressing to numbness and pain.
Now, is it a direct connection to diabetes, or can you get neuropathy other ways?
You certainly can get neuropathy other ways. And so prior to kind of this, epidemic of diabetes, actually, believe it or not, syphilis was the leading cause of people getting diabetes. So they would get an STD, it would be untreated, and there's a lot of complications with syphilis. And one of them is actually neuropathy. But there's other causes. So behind diabetes now, one of the most common causes is using alcohol. So alcohol use, heavy drinking, can also cause neuropathy. But then we have other things like low back problems can cause the nerves to not function right in the lower extremities. But when we talk about neuropathy nowadays, peripheral neuropathy, generally it's associated with diabetes.
And you also spoke about ulcers.
Uh-oh, we're freezing.
That was my reminder saying you've been on social for more than 30 minutes.
Hey,
So
the overstimulation, it's time to
yes, yes.
overstimulation.
But I wanted to know, what is an ulcer? Because in the data drop, it said that amputations can be prevented, preceded by a preventable foot ulcer.
Yeah.
What is a ulcer in the foot?
Yeah. So basically, an ulcer is a breakdown of skin. And so, yeah, an ulcer is a little bit deeper than just your normal like scratch or abrasion. It goes to the deeper levels of the skin. And so, what's so important is that if someone has neuropathy, meaning they can't feel, and then let's say they're wearing a bad pair of shoes or an old pair of shoes because maybe they're not wearing the right size shoe. We kind of talk about people, you should be, measuring people's feet. So they may have, be wearing a size shoe that's maybe too small. And then their foot rubs in the shoe some type of way. They end up like maybe with a little red spot. And then it keeps rubbing. They keep wearing that shoe. It keeps rubbing. And then you end up with a sore in your foot. And then that sore can just stay there for a long time. The longer a sore is open, the more that it can get infected. And so you may end up with an infection. And that if that infection travels deep, if it goes to bone, if it goes in the blood system, then you're in big trouble. And so that's why they're saying that an ulcer a lot of times will precede an amputation. And what precedes an ulcer a lot of the time is neuropathy. And so that's the big thing. So when people lose their feeling in their feet, they're at significantly increased risk of having an amputation. That's why it's so important for folks to wear these shoes and wear these inserts that are going to protect their feet when they can't feel. The person can't protect themselves, so we have to go the extra mile to put them into shoes and inserts that can help protect their feet.
So I don't know why I thought, is there another term for ulcer? Like, isn't there like a stomach issue, or am I
Yeah,
mixing up?
of course. So you can have an ulcer in the stomach. So all an ulcer means is a wearing away of some tissue, basically. So when you have an ulcer in your stomach, which can be caused by certain bacteria or acid reflux that's chronic, that acid wears away the lining in your stomach and creates an ulcer. The same way in your foot or your skin, it wears away. Or if you're someone like maybe an older person who's incapacitated, they're sitting in the bed all day, they have bed sores, or we call them decubitus ulcers because they're caused by pressure and it wears away the skin. So the same, kind of pathophysiology, just different areas of the body.
Right. Okay. Because so when people tell me, when I hear this term ulcer in the foot, I don't connect it to the feet. I'm always thinking, I've heard that term in your stomach
Yep.
or all the other things, but it's the same thing. Basically, an ulcer is the wearing away of the tissue,
Yep.
regardless of whatever area it is.
Exactly.
That's got my mind thinking. So
There we
how
go.
pressure inside a shoe turn into an ulcer?
So because that pressure, so let's say you wear a bad pair of shoes, or let's say like, a lot of us, especially I always gotta go to the women, when you wearing those tight shoes or heels, when they start hurting, how do you walk? You start walking all, crazy and you're like, man, she look like her feet hurting, and you see that person. But the reason they're doing that is because they can feel their feet. So you have an abnormal pressure between your foot and the shoe. So to avoid that pressure, what do? You start walking differently, right? Or, all of a sudden you just take the heels off and start walking barefoot through the city of uptown Charlotte. But
Yes.
if you have diabetes and you have neuropathy and you have that pressure, that uncomfortable shoe, they can't feel it. So what do? They just keep walking. And that their foot is hitting the shoe in an abnormal way, causing wear because they can't feel. And so they're just walking all dandy and just thinking everything is okay. So pain is not helping them at that point. They don't have the pain. That's why pain is sometimes a good thing so that you can adjust, how you're walking or the things that you're doing. And so when they have that bad shoe on, it's hitting their foot and it's causing their skin to wear away, creating an ulcer.
Okay, good information. So the diabetic foot program is a Medicare benefit?
Yes, I believe
Oh,
it's Medicare Part B, what it would
Medicare
be.
Part B.
Yeah.
Oh, so Medicare covers one pair of therapeutic shoes per year,
Yeah.
up to 3 custom inserts, and if the patient qualifies medically. What does a person like? What is the paperwork involved or the qualifications a person needs to meet before they can qualify for this program?
So that's where all this goes to, right? So, anytime the government gets involved in anything, it's paperwork, it's bureaucracy, it's red tape. So, the government tried to do a good thing to say, hey, let's prevent this and let's get these shoes and inserts to people who need them. But and I can get with the government. The government is also going to say, well, we got to make sure the people, who actually want them, they actually need them and qualify for them. So that can create a system where, you can get bogged down in paperwork and you really have to navigate it to get the people, the equipment and the supplies that they need. And so basically, a person with diabetes first has to be diagnosed with diabetes. And that makes sense, right? If you're the government, you want somebody who knows what they're doing saying, hey, this person has diabetes. So they have to be under a care of generally a primary care doctor or like an endocrinologist. So that person, that doctor has to say, okay, this person has diabetes and I'm treating them for the diabetes. So that's one. So they have to actually say that in their medical record. So they got to write it down and say all that. But they also have to sign another paper that's called a certification, a certifying physician statement, saying that I, as the physician, certify that this patient needs this. So after they get that, then they generally go to usually the podiatrist's office. So they go to the podiatrist's office, makes the appointment, and say, hey, I need diabetic shoes and inserts. And so then the podiatrist has to go and do a specified foot exam to say, you've had an amputation in the past, or you have severe neuropathy, or you have foot deformities like hammer toes and different things that's going to increase your risk of having a foot ulcer. And then once they do that, then we can send a prescription either to someone who's going to make it, or some podiatrist office actually will cast and do everything for the patient and do all of that in-house. Now, just talking about it, it seems like a pretty streamlined process. Like, oh, okay, this is not that bad. But there's certain things that have to come before other things. So a lot of times what will happen is that maybe the doctor, their regular doctor, sends in that statement and says, yes, they have diabetes, but in their medical note, it doesn't clearly say it. And so we send in all this paperwork, and then Medicare come back and say, well, their primary care didn't really say they had diabetes, or they didn't say, that they're actually treating them for diabetes. So that's another 2, 3, 4 weeks of trying to get that paperwork. Or they may not sign the certifying physician statement. Or maybe you thought you had all of that in, and then let's say they went to the podiatrist's office, they dispensed the diabetic shoes, but the certified physician statement wasn't actually in, or it was dated after you got the shoes. So there's a lot of things that can go wrong in this process because there's so many players in it. You have the regular doctor, the podiatrist, the person, if it's not the podiatrist, that's actually going to fit them for the shoes. So it's all these offices trying to coordinate when they're not all on the same team, on the same electronic medical record system. They don't answer the phone. They don't look at their faxes. And what do you have left? A frustrated patient. I tell you, if you want to see someone who's frustrated, it's someone who has diabetes, who knows they need their shoes to give them the better chance of saving their feet, but they can't just because of all the paperwork that's involved.
Right. So what mistakes causes the most delays? Is it on your side as a physician, or is it the qualifier?
Now, it's probably the hardest thing is getting the certified statement like kind of in time, because also the patient has to be seen by their regular doctor within 6 months. So if they've been seen by them, 6 months in one day, then they got to schedule another appointment with their primary care. And so how long is that going to take? Another 3 months to get in with their primary care. So it's just these little things that in and of itself, if you look at it, it's like, well, that's not that bad. But when you get into the real world and people's lives and how hard it is to get into the doctor and how hard it is for doctors' offices to communicate, I mean, that's the hardest thing, right? There are patients who come in and say, well, can't you just pick up the phone and call the doctor, and get this right? And it's kind of like, well, it's a process, we got to write a note and we got to send it to our medical assistant and they got to call their medical assistant, blah, blah, blah. You know, but the patient don't want to hear that. They just want to get what they're entitled to from their benefits and what they really, you know, medically need.
So are there alternatives if you can't go through, or if you get denied, then do you start the process all over? If it's one and done, if you get denied, then you can't like go through the process again. And
No,
if
you can go through it again. You can certainly go through it again.
okay.
And if patients want, they could pay for them. But who's
Right.
going to do that? You know, if I'm already, you know, paying, you know, Medicare premiums, you know, why am I going to pay out of pocket, you know, to get shoes that I should get under the insurance that I'm paying for? So I completely get that as well. Some people, there are kind of over-the-counter orthotics that are similar.
Okay.
But if patients have really bad deformities, they have really bad bunions, really bad hammer toes, they really need custom orthotics and a shoe that's really fit for their particular foot. So I really don't recommend them going out and getting over-the-counter ones because they really need something that's going to be custom to them.
Indeed. So what happens, because we know they're not the most fashionable looking shoes. I do have a question. Do you see like a particular age group, or it don't matter? You see all types of ages, occupations have qualifying or in need of these or these diabetic shoes?
Yeah, I mean, it generally skews to the older age because, again, you do have to qualify. You have to have qualifying features to get the shoes. So folks who are a little bit younger, even if they have diabetes, they may not have neuropathy. You know, we may test them and they can feel if they don't have the neuropathy or, you know, if they haven't had any type of surgery or really big deformities. And so it's going to skew toward, you know, the older crowd. But even though, especially like women, you know, they care about how they look. They care about what they're wearing. But I'll tell you, even in like the 15 or so years I've been practicing, the shoes have gotten better. They look better. You know, they used to just be these Frankenstein shoes with the Velcro, you know, and
Gray.
they come in gray, black, or brown, and that's all you're getting. But now a lot of them look a lot better. It's funny because I was in my office and I got a letter from a company who does diabetic shoes, and I was, you know, just thumbing through kind of the catalog, and I mean a lot of them just look like regular athletic shoes. You know, maybe a little bit wider, but if you were just passing someone on the street with those particular shoes on, you wouldn't know that they're diabetic shoes. And that's what I tell my patients. Now I'm like, we have a catalog. They look a lot better than what they used to. So I think you'll be satisfied with them. And if they're still talking, if they're still like, nah, I don't want that. I'm just like, do you want to lose your foot? You just gotta break it down. Do you want to lose your foot? And they're like, nah, I don't want to lose my foot. I kind of like having 2 feet. I'm like, well, get these shoes.
Right.
You know, so
Absolutely. That was going to be my next question. What happens when someone refuses to wear them?
they end up in the operating room. It's just where they go, especially if they really are bad. Like if they can't feel anything, I tell it's just a matter of time. If you cannot feel your feet, you are going to walk over something. It's going to be in the middle of the night, and you're going to injure your foot, or you're going to wear shoes and you don't feel that they're not fitting right, and you're going to end up with a blister. That blister is going to turn into an abrasion. It's going to turn into an ulcer. It's going to go into your blood system. You're going to end up in the hospital. I'm going to have to operate on you. Like I try to scare them a little bit. You
Yeah.
know, I'm like, you're gonna lose your feet, you know, and then they're like, okay, I guess I'll get them because sometimes you have to scare them a little bit just so that they can stay out of the hospital. You do not want to get in the hospital. Your blood sugar goes all crazy. You know, if you're older, you don't know if it's night or day. You start getting senile. You can't sleep. I tell everybody, if you want to lose sleep, the best place to go in the hospital. Nurses coming in all types of night, which they have to. They're doing their jobs. They're monitoring vitals, keeping people safe. You got noises beeping everywhere. You know, IVs going off. Like, stay out of the hospital. You know,
Right.
you don't want to have to go through that. And these shoes could be the very key to having you stay out of the hospital.
So how many amputations do you see where it started off with just a small sore?
And most of them. So when people have diabetes, diabetes is the number one cause of non-traumatic amputation. So if you're younger or you don't have diabetes, if you get an amputation, it's probably because you're in a car accident or you know you had a bad fall somewhere and broke your leg really bad. But for diabetes, I mean, most of them are from just folks just walking around and they end up with an ulcer and it ends up causing, you know, a blister or an infection that you have to cut your foot off. I mean, I've seen so many times where someone has a little toe, you know, ulcer and it's a little infected. 2 days later, they're fighting for their life because it's spread that fast. I mean, you get some of these bacterial infections, and you're talking about taking people to surgery to save their life, not only to save their foot, to save their life. And a lot of people don't get that. It can spread so fast, especially in diabetes, because your immune system is already compromised. So if you have an infection and then you have a compromised immune system, your body just can't fight it as quickly, and it goes to those tissues, and that bacteria, and it's no joke. No
I'm
joke.
here, Dr. Lanier.
I'm telling you.
So that's why it's important to get regular foot exams.
Yes.
Say we can't see under the bottom of our feet. A lot of people don't, take care of their feet until they start to feel pain. So
Mm-hmm.
regular foot exam, like we talked about last week, can literally save your life.
Yes, it can. I mean, it seems so benign.
Yeah.
When we say, hey, come in and get your feet looked at, it just sounds like, do I really need to do that?
Mm-hmm.
If you have any kind of immunocompromised condition, if you have rheumatoid arthritis, psoriatic arthritis, diabetes, anything that can't be healed very quickly by your own immune system, you need to check your feet out. Like, it's non-negotiable. You need to come in. You need to have someone looking at it. If your feet are okay and you have one of those conditions, once a year, it's just like the dentist. Most people I think go to the dentist twice a year to get the teeth cleaned. Nothing really going on with their mouth, but they want to make sure that their teeth are healthy, their gums are healthy, they don't have any mouth cancer or anything like that. It's the same thing with a podiatrist. Even if you feel everything is going okay, once a year, that's all you need to do. It's a relatively quick exam. Is pretty much painless. There's nothing that hurts. You just come in, get it checked out, and then you make sure you're on your way.
Absolutely. Here's a data drop. Every 3 minutes in the U.S., someone loses a limb due to diabetes.
Mm-hmm.
3 minutes. So we're usually here 30 minutes. So that means by the time we talk, 10 people have already lost a limb because of diabetes.
And the thing about it, when people have a major amputation, and we're talking about, below the knee amputation, above the knee amputation, their 5-year mortality rate hits almost like 80%. So that means if someone loses their leg in 5 years, they have an 80% chance of being dead.
They out of here.
They're out of here. So, I mean, just get that. I mean, that's greater than a lot of cancers. A lot of cancers don't have that increased mortality risk in 5 years. So amputations, infections are very serious. That's why the easy screening stuff you need to do, that it can literally save your limb and your life.
Wow. So like we always do is we wrap it up. Here's a trap or truth segment. So if you trap or truth, if you have diabetes but your feet don't hurt, I don't need special shoes.
Of course, that's a trap. So if your feet don't hurt, you probably do need special shoes. So, you need to go to the podiatrist. They need to check you out and see if you qualify and see if the shoes will be beneficial to you.
Cool. Trap or truth, diabetic shoes are just overpriced orthopedic sneakers.
No, they are custom made and they have custom insoles. So depends on who does it. You have a digital scan of your foot. You have a mold taken of your foot. So it's specifically for your foot. So it's not just some off the shelf, shoe that you can get anywhere. It's something that you go to the doctor, they give you a prescription, and you either have it done at the doctor's office or they send you out to a specified lab to have it done.
Now, those stores called Good Feet, is that what they're?
No.
No.
Okay. I can't really say that, but we should have like an episode of the Good Feet store. So I'm just going to say this about Good Feet. They don't do custom orthotics.
Okay.
So that's the big thing. So, Good Feet orthotics are very, very expensive. I've had a lot of patients who've gone to Good Feet. They spend a lot of money and then they come to our office. So that just lets you know you're spending thousands of dollars on thousands. Yes. Like I've had patients $1,300, $1,500 for off the shelf orthotics. They don't scan your feet. They're not licensed. They're not anyone who has been to school or taken an exam or been board certified to say, hey, these are the orthotics that you need for your feet. I'm gonna leave it at that though. Good Feet, that's a big company. I don't come on IG and be like, yo,
right. I like a little controversy.
you dissing Good Feet store for.
I like a little controversy, so I'll put that in the back of my notes. Maybe we should look into that. If you already had an ulcer once, am I at a higher risk of getting another one?
You absolutely are. So there's a podiatrist who works out of LA. He's probably like the most well-known podiatrist, especially in the diabetic foot space. His name is David Armstrong. I think he's the most cited podiatrist in literature and journals. Very smart guy, and he's kind of coined when people have diabetic ulcers, and let's say they heal it, just like cancer, they're in remission because they're at such a high risk of developing another ulcer. And so he doesn't tell his patients, hey, you're cured, you're good to go. He just said, hey, you're in remission, and you gotta come in, every 3-6 months. We have to monitor you. We take X-rays. We do these studies to make sure we put you in a space where hopefully we can decrease your risk of reulceration. But it's a very high rate of reulceration.
So, but it can be healed, and can it be healed naturally, or there's some over-the-counter things that you got to do?
It depends on how bad it is. So if it's an ulcer that's not deep, the main things to heal an ulcer, that could be another topic. You have to have, good nutrition. So you got to be eating right. It has to be free from infection. So anything that's infected is not going to heal. You have to properly, and this is probably one of the hardest ones, you have to properly offload it. So meaning if it's on the bottom of the foot, you can't walk on it. You got to take the pressure away from it. So and that's hard, especially people if they're in a blue collar, situation where they're working or they're just walking around all the time. There's no way you can heal an ulcer on the bottom of your foot if you keep putting all that pressure through it. So you really have to really take care of that. And then also you have to what we call debride the ulcer. So meaning cleaning up the ulcer. If you go to a doctor's office and you have an ulcer, usually they're going to take out like a scalpel, a knife, and they're going to clean it up, and they'll probably make it bleed a little bit because when it bleeds, that brings good nutrients and everything to the ulcer. So there's ways to heal it, but most of the time, healing an ulcer takes quite a bit of time. That's why you don't want to get one.
Right. Mm-hmm. Trapper truth. Insurance makes the process hard because they don't want to pay anyways.
You know how I feel about insurance. So yes, I mean, there's so many loopholes to go through with the shoes, with certain products we want to use to heal ulcers. You have to do certain things before you can use things that are going to work. And sometimes you see someone who has an ulcer and it's like we make sure they have good blood flow. We're offloading it. It's not infected. They're eating good, but it still won't heal. They may need a specific type of graft on it or a specific type of wound gel. And to get those things covered by certain insurances can be difficult.
Mm-hmm. And last but not least, wearing stylish shoes or stylish sneakers with custom inserts is just as safe.
No, so not for folks who have neuropathy. Okay. So I don't want to say to everybody, if you're pretty healthy and you got good shoe, like stylish shoes and inserts, and you're probably okay. But if you have neuropathy and you're at high risk of ulcers, no, you really need to invest in diabetic shoes and making sure that you're tuned into a podiatrist who can really watch over your feet.
Absolutely. Well, that concludes everything tonight. So tonight isn't about ugly shoes. It's about keeping your mobility, because once you lose your toes, you don't lose your toes, or you don't just lose your toes. You can lose your balance, your stability, your independence, and ultimately your life. So it's not about the drip and the fashion and design, but it is about mobility. And that is what generational health looks like. So if any one of you all out there that has diabetes or know someone that has diabetes or not, take the time to get a foot exam, because it can literally save your life. So that's all that I have for tonight. Thank you again, Dr. Neer. That was some really good information.
Cool,
Where can I find you?
Yep. So Smart Step Foot and Ankle. We're on socials, mainly Instagram and Facebook. Holler at us. Go to the website. Follow us, and we're giving these good tips, and we're always online.
Absolutely. And that's another 10 Toes Down episode. I'm Sheena, Alpha Male Nail Care. Fellas, come and get your pedicures. It's getting warm outside. It's sandal season. Pull up on us, all right? Everyone have a good night. Thank you.
Have a good night. Bye-bye.